Good evening to all the viewers who are watching live and will be watching on the recorded version. Before starting this CME, let's just take a time to congratulate as we are going towards the 100th CME, which is nearby soon. 9 more CMEs to go. And we have already wasted 4 more minutes. And so, without wasting any more time, let's just start with the title track.
Good evening, everybody. Good evening, Kalyani sir.
Good evening. Good evening.
Uh, we had missed a day of CME on the last 2 weeks back due to several technical issues, but however, with grace of God and the cooperation of our stalwart homeopaths, alumni of NIH, we are back on the 91st CME tonight. So on this 91st CME tonight, we have a host of surprising personalities to be introduced to. And with your permission, Kalyani sir, may I call on the
Sure.
inaugurator tonight?
Please.
Sir?
Yes, please. Call sir. Please call it.
Thank you, sir. Our inaugurator tonight, we are proud to bring him on screen, our first academic in charge. The time myself, first batch of BHMS in NIH, along with Pralay, Trideep, Usha, and all our batchmates. He was our academic in charge. And the time we did our internship, completed our internship, he was the hospital in charge. Our beloved Ghosh sir, Dr. Sarasija Ghosh.
Yes.
Good evening, sir.
Good evening.
We
I'm
are
very
proud
much happy.
to bring you on screen tonight.
Yes. Go ahead.
It's over to
We are
you
lucky
to inaugurate the session tonight, sir.
And
We are
let
lucky
us
also,
start.
right?
And the subject you have selected is the primary important medicine of the homeopathy. One of my teacher, PC Adro, used to tell, if you learn sulfur and Naxbhumika, half of the mathematics is will be at your grip. And we are lucky to get Dr. Kumar Bhattacharya, ex-director of our institute. And I can request him, when I started the practice and snatched the credit of curing a severe skin disease with the help of the sulfur, which was prescribed by other physician, and he only waiting cured the case, just prescribing placebo. That story I have learned from him. I will ask him to tell that story also. It will be a clinical credit and clinical knowledge should be enriched. But Byasdeb Ghosh is my student in the DPNIH. I am very happy to see him. And from very beginning, he was very much busy practitioner and very attentive in class. I request him to start his program, and I express my thanks to all of organizers and the participant and the contributors of that seminar. Please start your program. Go ahead.
Thank you, sir. Uh, we are proud to have you on screen after so many days, and we pray to God that you stay healthy and ever smiling forever. And our beloved, respected, the emeritus teacher of teachers, the moderator tonight, we have with us Professor Samir Kumar Bhattacharya sir. Sir on
Good
screen.
evening to everybody. Uh, Let us start the discussion. I will request Dr. Byasdeb Ghosh to start his speech. And within within his lecture, I think we will learn many things. And whatever my experience I want to add, I will add afterwards. So, without wasting time, I am requesting Dr. Byasdeb Ghosh to start his speech.
From Dr. S.K. Bhattacharya and Dr. S. Ghosh and Dr. D. Kalyani. If they bless me, I will be hero. If they do not bless me, I will be zero. So I pray from them and their blessing. And I congratulate all the members of Alumni Association of NIH, and special thanks to Dr. Chandrasekhar Pode, who constantly stimulate me to join in the CME. Previously, he once called me, but it was not possible by me. But thereafter, he is constantly poking to join his, and I feel highly proud and pleasure in my heart due to the joining with you. And Dr. Bidyut and Orko, they are um, um, constantly attempting to develop this successful seminar. So I also thanks to him, and I am grateful and thankful to all the doctors who are with me. And before going to my topics, I want to tribute my respect to father of Hanuman, and in the April, the month of his um, birth month, who was a multifolded genius, a great physician of all ages, um, a successful chemist, and he knows many language and translates. So multifold geniusness is within him. I salute him from my heart. Now come to the point, sulfur. Better to say the practical use of sulfur will be discussed here, because all we are doctor and we all know sulfur, and we always using sulfur. There is no physician that not using sulfur. Sulfur is very, very important and polycrest antisodic drug, and it is used for more than 2000 before Hahnemann, and it was used mainly in the form of sulfur bath, sulfur lotion, sulfur ointment, etc., mostly for external application. I think it was not proper use, and Hahnemann mentioned 97 cases where the due to palliation or suppression of disease, lot of complication, numerous types of problem develop, numerous types of disease develop. সবাই আপনাকে দেখতে শুনতে পায়। আচ্ছা, sulfur, calcarea, lyco. This trio is a pivot system of our materia medica. Sulfur is in the central axis of this system, and all the rest of the drugs are surrounding with this trio, sulfur, calcarea, lyco. Sulfur having 1969 symptom, so it is a vast drug, but within very short discussion how we can recognize a sulfur patient, that is our most important point. When a patient come to our clinic, we see that patient, he is tall, slender, or dwarf, dirty or clean, etc. But on looking from outside or the constitution of the sulfur, it is typical sulfur patient is lean, lank, stoop shoulder, hungry, old dyspeptic patient. Atypical may be fatty, may be rotund, and well-fed person. But typically lean, lank, old dyspeptic, and abdomen is comparatively bloated. And from outside we can see his hair is coarse, dry, and may have various types of eruption on the scalp, on the face. There may be ragged. Ragged is the furrow near angle of mouth, angle of nose, on the palm, finger, etc. It is the last stage of congenital syphilis. So although the sulfur is the king of antisoric, but it having the role of psychosis and syphilis, but where it is there where soric manifestation is predominant. In such cases, we can prescribe sulfur, not in pure syphilitic or pure psychotic cases. Sulfur is stoop shoulder patient. That is, it have action on the spine. Mainly, kyphotic constitution is present. In calcarea phos, we find lateral bending, that is scoliosis. In calcarea curve, we find kyphosis, scoliosis, lordosis, all are. Sulfur, if we go to the schematic diagram, as we make the case record, that is, we asked after entering the patient that what is your appetite. If I go through this schematic diagram, then it will be very in nutshell, it will be very easily understand. So time will be saved. That's why I try to follow the case record pro forma. Then if I ask, what's about your appetite? Sulfur patient is hungry patient, always wants to eat, but when he goes to the dinner table, after taking a few mouthful, eat low this, and taking water. Sulfur patient is thirsty, taking less food but drinks much. After a few mouthful, took water again. In this way, it is bloated. After taking least food, but much water, it is the sulfur patient. Arsenicum patient having thirst, that thirst is small amount frequently. But in case of sulfur, large amount frequently, small amount frequently. It is found in each and every types of disorder. Suppose that's fever and other systemic disorder. Appetite, thirst, and appetite is very gnawing organ empty sensation at 11 o'clock. It is written, but this empty organ sensation is not found only at 11 a.m. It may be 12 noon. It may be 1 hour before scheduled lunch. It may be immediate after bathing. After bathing, having a special affinity of aggravation of patient, bath aggravates various problems, catches cold, etc. And immediate after bathing, he cannot wait for food. When he goes to bathroom, he asked his wife to make ready the food. So appetite is this type, thirst is this type, and desire, sulfur, desires each and every food. But special affinity is there. He craves sweet, craves sour, and sulfur is a hot, warm drug which only craves fat, according to Dr. Tyler. So the sulfur patient having craving for sweet, which also disorder, craving for sour, wine, alcohol, all types of wine, alcohol and wine, especially coarse alcohol. And aversion is milk and meat. Once I got a patient who came from Bankura, who was a drunkard, highly drunkard, and due to the constant drinking alcohol, he has alcoholic liver, cirrhosis of liver. There are two types of cirrhosis of liver, একটা alcoholic, একটা non-alcoholic. He was cirrhosis of liver, but he cannot resist him to drink alcohol at all. And in this way, his business was almost stopped. He did not attend his business place. Then he came to me for the problem. I looked the patient. That patient was sulfur patient. Sulfur patient is dirty. It is irregular distribution of circulation. Mainly venous stasis is there. So face become reddened and dirty. And after asking few questions, I think that he may be developed by sulfur and prescribe sulfur 1 m. And after 1 month, he came to me and told that you asked to review after 1 month. That's why I'm coming, but I will not come to you more because the addiction is already controlled. So we have some medicine by which we can de-addicted the patient. Hence, I can mention and a few drugs, that is syphilinum, hereditary alcoholism, aceram, um, uh, acid salts, um, and so on. But we have no specific drug for this. Our specific is most specific for the for that specific person and for that situation. It is not that suffering from fever, so take crocin or paracetamol like that. We have to understand the patient, that that patient may take bryonia according to symptomatology, may take dalkamada, rustox, gelsemium, sulfur, according to symptomatology, but no specific. And specific, most specific for the most specific cases. So we have to understand the drug properly. Desire aversion disorder, stool, sulfur having specific type of diarrhea. It is known as sulfur diarrhea. Constipation is also there. Constipation is like bryonia, but maximum provers did not produce constipation, and there is also diarrhea alternate with constipation, and diarrhea is early morning diarrhea at 5 a.m. or after midnight, and that diarrhea persists at up to forenoon, noon. Generally, occasionally or rarely, it may persist at afternoon also. But generally, morning diarrhea means morning. After morning, he is okay. He can go each and everywhere, no problem. He can go freely each and everywhere. So, and diarrhea, all the secretion and excretions are highly offensive, highly excoriating, and highly burning. The sulfur patient passes scanty stool, and that is thin and excoriating and burning. And that offensive is highly offensive, which runs throughout the day to the patient. He can realize the offensive odor. If the patient suffer from leukorrhea, and that is offensive, and that offensive he can feel even after wearing proper dress, etc. He is constantly imagines that the odor is coming. Sulfur patient is filthy patient. We can compare with pig or swine. They have no importance to cleanliness, and they are filthy, they are dirty, yet they are sensitive to filthy matter, yet he takes the filthy matter and take in, and the offensive odor from genitalia, they try to smell it, that offensive odor. This nature is present in sulfur. Urine. All the secretion and excretions are offensive and burning in nature, corroding in nature. So it is present in urination also. After passing urine, the scalding the urethra, and the patient uses much amount of water. So appetite, thirst, desire, aversion, disorder, and stool already mentioned. But here we can compare some drug with this diarrhea. Morning diarrhea is present in allosocotrena, in phosphorus, in natrum salt. and every drug has its specific nature. Natrum sal patients, after lifting the bed, when attempt to walk immediate after first taking, he has hurried to stool. In sulfur patient, drive out of bed. In bryonia patient, immediate after opening the eyes. Sulfur patient, bryonia patient is aggravated by motion, least movement. So immediate after breaking sleep, when he opened the mouth, opened the eyes, the urging started. And brain phosphorus patient having that type of diarrhea at morning as if from bunghole. It is anus is wide open. In Stuttgart hospital, there was a patient which was taken in table for operation. But after looking the wide open anus, the surgeon who knows homeopathy, he refused to operate and prescribed phosphorus, and phosphorus cured the patient. Another important drug is Apis mellifica. Apis heart patient and glandular diathesis, cancerous diathesis, phosphorus, tubercular diathesis, lean, thin, emaciated, narrow chested, universal restless patient, universal burner drug, phosphorus, arsenic, and sulfur. Arsenic burning is amelioration by hot application. Phosphorus have burning in between two scapulae before back of the stomach is characteristic, but burning is there, palm, sole, here and there in each and every hair. So, according to the symptom similarity, we will prescribe phosphorus, bryonia, natrum sal, and so on. This is our specific prescription. So, stool, urine, sweat. Sweat is very offensive, highly offensive. Sulfur patient is king of antisoric drug, and sorinam is, I think, queen of antisoric drug. They are also highly filthy, offensive odor, carrion-like odor. Sorinam patient is chili patient. Sulfur is hot patient, burning palm, burning sole, hot vertex, and organ empty sensation at 11 o'clock is the sine qua non of sulfur. That is surest sign of sulfur. Generally, during case taking, we never ask the patient question directly, but Dr. J.H. Clark, who was habituated on looking patient dirty, unhealthy, and this venous congestion, red face, etc. He asked, have you burning palm or sole? If patient told that yes, I am burning palm and sole. Then he asked, have you burning vertex? If he told that yes, hot flushing is there on the vertex, then he asked, are you feel severe hungry, empty organ sensation in any time? And that is 11 o'clock. He told that I prescribe sulfur, what may be the cases, and sulfur never disappointed him. So I am going through the pro forma of case taking. If the pro forma is similar with the sulfur patient, then we will prescribe the patient sulfur what may be. because sulfur is such a drug. Sulfur is present in all the tissues of the body. So any type of disease from simple cough, cold, acne, various types of skin disease, various types of eruption, to to OCD, obsessive compulsive disorder, or in sulfur in Kent material medical, it is written monomania. Monomania means sulfur is thinking one thing and he is constantly thinking that side, one after another, questions one after another regarding that patient, regarding that subject. Ragged philosopher, ragged scientist, false scientist, but in this way they occasionally invent or discover something, and they think that he is the uh, he is the person who is mostly honorable. And why the people are not honored him in such a way? He thinks he is the majesty, he is the king. So our কি বলবো OCD to schizophrenia. Schizophrenia patient is the most most bad type of most worst type of patient in mental disorder, which we call insane person. They are found in street here and there. They are wearing people dirty dress, tear dress, thread broad clothes, etc. And he think he is the majesty. Like that, his psychology. Stool, urine, sweat. Even sweat is so offensive, urine is offensive, stool is offensive, all the discharge, nasal discharge offensive. And immediate after washing the shoulder, the offensive order persists. Once I met a patient who was very dirty, unhealthy, not cutting hair, and not shave the beard. He was a son of a professor who was head of a department in an university. That professor was highly dirty. He did no importance to cleanliness. He came to me and poking fingers in nose, and it is putting on the table, etc. And after using, after urination, he did not flush the commode, and he was very miser. When I first saw him, he was a patient of ischemic heart disease, hypertension, and old dyspeptic patient. Esophageal reflexes was there. What he took after taking food, that regurgitates, and occasionally it came out. Anyhow, once he was suffering from pain chest at his home, very near to me, and in that complexion, a MD doctor was there. In that complex, he visited the patient, and another MBBS doctor visited the patient. This was his second attack. And I was called thereafter. I know the patient for this filthiness, selfishness, great miser, etc. So, irregular distribution of circulation is one of the pathophysiology of sulfur. So, when it congested heart, the circulation becomes slow. He feels pain, and he throws all the dresses. Only underwear was there, and he was moaning. Then I asked, if you take homeopathic treatment, then you have to take homeopathic medicine. No other medicine should be taken. And initially, I prescribed sulfur 0/1, gradually increasing, and he was okay. And one day, again, sudden pain chest, and that hot flushing and restless feeling and moaning was there. I called at that time, and next day he have to go Delhi for university. Some meeting was there in Delhi. Then asked, most probably the plane ticket should be cancelled. But I told, need not cancel the ticket. You will able to go after taking homeopathic medicine. Anyhow, that sulfur was continued. Only placebo was there given, and next day he was better and went to Delhi. And his son was an engineer. He was ready to go America for study, but his scholarship was not up to the mark. So the father asked him second time admission test for getting more scholarship, and it hurts the son violently. Thereafter, he reject each and everything and constantly stayed in his room without any correspondence with anybody, even to father, mother. All day he was in that room. After uh, sleeping father and mother, he awakened and take food from the fridge and read a newspaper, TV, etc. And whenever father rises, father was a morning worker. When the father awakens to go morning walk, he lie down and sleep, whole day sleep. And at night, after sleeping father, mother, he take his bath and food, etc. In this way, several years passed, and his grandmother was seriously ill, and ultimately she died. All the relatives from here and there, from America, etc., all the relatives attend, but that boy did not attend the funeral celebration and did not meet with the relative, etc. And one was a psychiatric doctor who practiced London. He was his uh, um, paternal aunt. He attended to talk something about the matter with the son, but he was failed. The boy tried to hit the psychiatrist. Thereafter, few days after, his mother came to me that will you able to treat my son? I told, "Oh, no problem. We will able to treat, because homeopathy having that power that giving medicine is not difficulty." Then she asked, how you will treat? He will not come to you. He will not take your medicine. I asked, whenever he will take food, you give the medicine in pulses or in a glass of water. Uh, that will be okay. And some placebo, it will be mixed in other way. Anyhow, after uh, um, 1 or 2 or 3 weeks after, um, he stopped the door. He stopped the closing of the door. He opened the door, and similar procedures continues. He stayed in room. Thereafter, he gradually start uh, to talk with father, mother, etc. In this way, he became normal. And when the father went to Delhi for plane, etc., he took the bag to the airport, etc. And it is one of the important feature of Sulphur. He did not cut the hair, nails were uncut, mm, and did not take bath properly in this way. And after listening some points from mother, and I know the patient previously, it was known to the patient to me, and considering each and everything, I prescribed sulfur, and sulfur cured the patient. So sulfur is like that type of patient. It may save a patient's life. Anyhow, his pungent odor of axilla was most important, which I known from his mouth previously. Uh, anyhow, so sweat, appetite, thirst, desire, aversion, sweat, sleep. Position of sleep of sulfur is a specific. Most comfortable position is lying on back with hand keeping on the forehead, like pulsatilla. We have uh, several drugs by which we can consider this specific, due to this specific posture, we can think some drug, that is knee chest posture, which is found in Suriname, which is found in tuberculinum, medorinum, etc. Medorinum also having thirst and burning soul, like sulfur, but medorinum itself is predominantly psychotic medicine, whereas sulfur is predominantly sodic medicine, king of anti-sodic. Position of sleep and sleep. Sleep is highly disturbed. The patient sleeps at evening, wake up at 3 o'clock, then sleeplessness, and the sleeps started at early morning, which is very sound sleep, and rises delayed. So delayed riser, like Nux vomica, like pulsatil also having that type of sleep. And dream, as Sora affects the emotion. So dream of sulfur is related with emotion. He he wakes up with happy dreams which causes singing, and he dreams fearful dreams like pursuing of pursuing of wild animal has been bitten by dog, etc. So various types of dreams are ludicrous dreams. Ludicrous dreams mean laughable dreams. One of my patients who told he dreamed that Amitabh Bachchan came to him for learning acting, and he was failed, and I repeatedly beat him. This is ludicrous. It is also found in sulfur. In arnica, when the patient lies on back, he dreams that type of dream. And in sepia, the dream is when the sepia patient lies left-sided. They dreams this type of ludicrous dream. And one of my friend who had a dream, he told me that he dreamed that one princess came to him with short dresses, with a horse, and offered him a big size cigarette and asked, ride the horse and go hurriedly. And he was very happy. He was riding with that princess in full motion. It was one of the important dream told by my friend. This is sulfur dreams. And now heat and cold relation. Sulfur predominantly hot patient, but basically they want static temperature. Least deviation of temperature, it affects the sulfur patient. And he wants fresh air. He wants to open the door and windows and during sleep. That fresh air strengthen the patient. And occasionally during sleep he feels suffocation and opens the door and windows. This type of hot cold relation is there. And covering aggravates and the burning. Sulfur patient having all types of eruption, and which is very much burning, and after scratching, burning started after bathing, and each aggravates. Sulfur patient and having aggravation by bath, catches cold, etc., etc. So, and addiction, heat cold relation, covering, bathing, addiction, and is alcoholic addiction, and coarse alcohol is better. And then goes to past history. In past history, we may find various types of suppression of discharges, suppression of skin diseases, etc., by which we can guess that he may be a sulfur patient. Then goes to the mental plane. Mental plane, in mental plane, already mentioned that sulfur is monomania or having OCD, obsessive compulsive disorder. A patient came to me who was getting ready for examination, and after saluting the goddess several times, he thought that salutation was not proper. That's why he again start 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and he thought it was not properly, and it continues even when he is in examination hall. He started to salute, and severe or tremendous headache developed. Then his mother came to me for that student's headache, and I prescribed sulfur, and he was definitely the dirty patient, lean, thin, etc., which is mentioned in sulfur patient. All was present, and it was cured. Mentally, he occasionally he is highly uh, he is highly depressed, melancholic. He thought he has sinned away. He lost the grace of God. In melancholy, his life is very miserable. He thought that his salvation is not possible, etc. And he thinks himself about, no regards to other at all. He regards himself only. And having question after question. One boy came to me who asked, "What is this?" Immediately after that question, he asked another question without waiting the answer. This is another type of personality which sulfur have. Uh, Sulfur means selfish. Sulfur means suppression. Sulfur means lack of symptom. Sulfur means paucity of symptom. Sulfur has defective reactive vitality, that well-selected medicine fails. In such cases, sulfur is one of the medicine which will cure the patient or will pave the way. Here we can consider also Suriname. Suriname having this type of disorder, and it is mentioned that in acute cases, sulfur is mostly indicated, and Suriname in chronic cases. Suriname Chile patient and having filled the offensive order, carry-on like order, A-graded Chile patient, etc. After fever, his appetite and does not return, profuse perspiration, etc., and debility develop. In such cases, according to symptomatology, we can prescribe sulfur and Suriname. I like to mention an important patient. One of my students recorded the case in my clinic, and after finished his record, she told he stood first in Kolkata University in BHMS. She told, sir, everything is normal. Desire okay, aversion okay, appetite okay, all are okay. And he is suffering from bronchial asthma, hypertension, and diabetes mellitus. I told him the criminal is always hides, but um, he must have something which we will find. We will have the clue. Try to understand where from which point we will proceed. Then he was an engineer of corporation, and after returning, he is a businessman promoter, and aged about over 60 ages. He was not fresh as it ought to be. He was dirty, filthy, and he told he drinks 2 pegs regularly before bed. He told that one cardiologist asked him to take alcohol regularly, which will helpful for his heart. And one symptom elicited his house was on the pond's side, and he wanted to swimming, wanted to bath in pond, but he had allergic manifestation after bath. Then I told my student that clear-cut indication is there. See that after bathing aggravation, once alcohol and dirty filthy patient. So in such cases, sulfur is an indicated drug, and Dr. Keynes advised us where paucity of symptom, we try to understand the miasmatic dyscrasia. In sulfur patient, we will prescribe king of antisuric, that is sulfur. In syphilitic cases, we will prescribe and king of antisuric, king of antisyphilic, that is Maxwell. And in psychotic cases, king of antipsychotic, that is Thuja. In such way, in paucity of symptom, we can proceed and we able to prescribe successfully. And after taking sulfur, he gradually feels better. And one day he told that my youthness returned, and really his complexion and brightened, and he started the dress clean cut dress, which was not previously. He was not given importance in the dress, anything wearing, no problem. But now he is using clean dress and bright face, etc. He told that new life is now he is enjoying. Thereafter, after 1 year of sulfur, he needed calcarea curve and lycopodium. He was very miser. In this way, he is free from bronchial asthma. He is bathing in pond, etc. And he is now okay. regularly pressure checking and, and diabetes for sugar checking, etc. done. And it is almost okay. Occasionally it is elevated little bit. Again it become normal in this case. So this type of patient is highly improved by sulfur. And one word I have to say, and that is scrofulous diathesis, which is mentioned in by Dr. A.C. Allen in his keynote at the very first line. Scrofulous diathesis. Scrofula is related with tuberculosis, and sulfur established me in my area. One patient came to me at noon suffering from fever for few days, and that fever aggravates at noon, and that child that was not childish looking, but it was old looking, and he's suffering from cough and cold. Then I asked some investigation, 1-2 test, X-ray chest, blood, etc. But they denied. At that time, I was final year student. The patient was under child specialist, and after few months, the baby developed hemoptysis. So after taking sulfur, that fever was subsided. I prescribed sulfur 200, and the fever subsided next day. It was striking to them, so they believed me. Anyhow, after a few months, when the hemoptysis started, they again come back to me, and it was diagnosis a case of tuberculosis, TB lung. Anyhow, but after taking sulfur 200, the patient improved nicely for 1 month or like that. So they had faith to me also. Then when hemoptysis and tubercular lung diagnosed, they came to me that, will you able to cure the patient? I told, I can attend few days after my final exam is there, so I will not visit any new patient, but I will treat your baby. Then I prescribe sulfur 0/1, 0/2, 0/3, 0/4 in such way. And whenever I prescribe sulfur, I feel pain in my chest that I am giving sulfur 0/1, 0/2, 0/3, 0/4, but the patient is improving. But I feel distressed that sulfur is contraindicated drug for TB patient, and I am giving sulfur. So I contact with Dr. SPD, said, this is the patient I am giving sulfur. He scolded me, you will not able to practice at all, you will die with starvation, you feel very Pandit, very much, he feels a great physician, you are giving sulfur one after another. At a long interval, 1 day's interval, 2 days interval, 3 days interval, in such a way. Then I told Dr. SPD, sir, this is the case, what I will prescribe. Then he asked me, you give sulfur 31 dose and wait for 1 month to returning the symptoms by which we will proceed. So I prescribe sulfur 31 dose, and after 15 days that baby started emaciation, cough and cold, and loss of appetite, etc. And the glaze which occurred, that is also lost. The patient become old looking, red face, dirty face, a melancholic appearance, dark discoloration around the eye, etc. Then I prescribed again sulfur 0/1, 0/2, 0/3 in such a way, and after certain time, she had no problem at all. She is now two daughters mother. Already one daughter is married. In this way, I understand that at the very beginning of tuberculosis, sulfur may be prescribed. Then once I went to take advice for one of my patients to one of my eminent teacher who teaches our organon medicine. He asked me, you listen me my case, then I will listen your case. Then he told a case who is suffering from tuberculosis, and symptom was indicated the sulfur. I asked him, you prescribe sulfur. He told, in case of prescription, in case of tuberculosis, sulfur is better to avoid. I told him, if you not prescribe, you give me the patient, I will prescribe him sulfur, and after curing, I will return back the patient to you. He told, how much confidence you have. Then I told the story. The patient, and anyhow he agreed to prescribe sulfur patient and sulfur, and that patient also is cured. But sulfur is not prescribed where fibrosis or calcification in the lung is there, because sulfur having tendency to suppuration, tendency to normal healthy tissue division. So decalcification or fibrosis will be suppurated, and pyothorax may develop, and that aggravation, if it is violent, it may spoil the patient if the vitality of the patient is poor. So if you try to prescribe sulfur, must take the caution again. And one important case I have to mention, that was a patient very close to me, he who had hemoptysis. Early, about 4.5 liter hemorrhage was there, and he was admitted in the AMRI hospital, Amdi hospital, and he was okay. 1 year after, he again developed hemoptysis. At that time, that bleeding was almost 1.5 liter, according to the prescription of the AMRI hospitals doctors, and he became emaciated and constant pain throughout the body and difficulty to move, and he was under a physiotherapist, and constant massage therapy was there. He had to shop in Kolkata. He was a gold and jewelry businessman, and all business was stopped. And when he came to me, I considered that hemorrhage, burning, and that neurological problem, difficulty to move, difficult to do anything. And I prescribed him phosphorus. He had a tendency to take cold water, etc. Then within very short period, you can say after 7 days, he is able to walk here and there and attend the business again, and he gradually gets stamina and almost recovered from the problem. In the meantime, most probably I prescribed another drug that was calcarea carb, and his indication was totally sulfur patient. And I, whenever I prescribe, I written there in the casebook, no prescriptions, no prescription for sulfur, no, never give sulfur, never give sulfur. And most probably after 1 year or like that, I advised to make an X-ray chest, and that X-ray chest had no focus at all in the chest. Chest was completely okay. I admired how it is possible. Anyhow, then I think that chest is okay, lungs is okay, sulfur burning, etc. All the selfishness, everything is there. So sulfur may be prescribed as an antisoric for conclusion of the treatment. Then I prescribe sulfur 0/1. And next day at 11 o'clock at winter, when I was in my home after clinic taking dinner, his son uh, called me in telephone, "Doctor, what happened? My father is again bleeding start." I told that, please you come to my chamber. My chamber is two 2 BHK chamber. So there are scope to treat by keeping the patient at night. I asked to keep the patient in my clinic, and I given him placebo, and the bleeding stopped. Then again bleeding. Then again I prescribed sulfur 0/1 in high dilution from second glass. In this way, he became okay. So homeopathy is true. It is that case that sun rises, when sun rises it is red, and when sun sets it is red. So that hemoptysis returned, and the patient developed in each in his buttock. In this way, he was he cured. It is my great experience by the sulfur patient in tuberculosis patient. And I got a tuberculosis patient. He was very advanced stage, and that lady was admitted in TB hospital for 6 months, and he had coarse crepitation and so on, and indication was completely sulfur. Then I told, in such cases, I will not give sulfur at all. And giving this and that medicine just relief, not so remarkable relief at all. Then they told that it is the lost case, we have nothing to do. Then I thought, in such cases, if I prescribe sulfur 0/1, then what happened? I like to see. Then I prescribe sulfur 0/1. Next day, the patient's son told me that my mother's suffocation is diminished. So local palliation started. I am afraid, and I asked to stop the medicine, and after a few days again I prescribed sulfur 0/1 in high dilution, and then the suffocation little bit improved, but other phenomena of living was not improved at all. Appetite, etc., not developed, sleep not good, and ultimately she died. So, in such advanced case, we have to avoid sulfur, silesia, like drugs, which is advised by our stalwart not to prescribe. And I now I come to the proper sulfur and its important feature. I told the sulfur in nutshell, that is looking, gesture, posture, build up, and our case history by which we prescribe the drug in way. I think it is an easy way, but and in nutshell, we can prescribe the sulfur in way. Anyhow, sulfur having specific aggravation at midday, midnight, like arsenicum. Arsenicum album having aggravation after midday and after midnight. 12 after 1 or 2, 1 to 2 a.m. p.m. like that. And arsenicum patient is very fastidious, tidy, neat and clean. Gold-headed cane patient. Sulfur and argentum niticum. Argentum niticum patient having craving for sweet, which is disorder. He is also old looking. Sulfur having the property of I mean to say that is circulation and defective reactive vitality, paucity of symptom, and in such cases, if we prescribed sulfur or sorinam or another drug, cifilinum, etc., on basis on that specific patient, the sulfur may arouse the vitality and may find out the indication of other drug. In such way, we can cure the patient also. Sulfur having irregular distribution of circulation, which is very pathophysiology of the sulfur. Congestion of chest, congestion, stomach, congestion, and in rectum, congestion in ovaries, marking the onset of tumor or malignant growth. So sulfur is applicable in malignancy, in tumor, sulfur is present in each and all tissues. So in each and every disease we can able to cure if it is curable case. If it is not curable with our medicine, we can give her great relief. That relief is also very important. And sulfur is indicated for simple cough and cold is to OCD, schizophrenia, cancer, tuberculosis, even HIV. HIV, where the lack of vitality is present. So sulfur is highly indicated drug. Sulfur having related to others lot of drugs. Dr. E.B. Nash compared the sulfur with 116 drugs, and he mentioned that sulfur is lean, thin, emaciated, dirty, filthy. All the orifices are red like vermilion. And he compared the sulfur with other spear drugs as Nux vomica. Nux vomica is irritable, dyspeptic patient, quarrelsome, ardent character, and complementary of Nux is sulfur, and after sulfur may need Nux in such a way. And tuberculinum is another important drug which we can compare with sulfur. Tuberculinum having lean, thin, emaciated spear drug, and changeability is there. Changeability is also present in that cases which is goes towards worse, that is metastasis is there. Suppose after curing dandruff, the patient may develop uh, some eczema or other skin disease or eruption or itch, and after suppression of that skin disease, he may develop another problem like psoriasis or anything else. And after treatment of psoriasis, he may develop lung affection or insanity, etc. In this way, he may develop the cancer or cancer-like invertebrate disorder. In such cases, we can prescribe tuberculinum and carcinosin. Carcinosin is a uh, very polytrace drug. Soda, syphilis, psychosis, everything is there, and lot of suppression, and there are indication of several drugs at a time, and invertebrate insomnia and invertebrate constipation is highly present in carcinosin, which Dr. E.B. Forbistar prescribed as said by Dr. S.P. He told in London Royal Homeopathic Hospital, Dr. Forbistar prescribed sulfur, prescribed carcinosin for invertebrate constipation and invertebrate insomnia. Another important drug is lachesis. Lachesis is tall, lean, thin, but less melancholy and chloritic person. Chloritic means highly ambitious, social, and talkative, and hot flushing is there, which is present in mainly at climatic age, and which is also present highly in sulfur. And in America, the lady after menopause, they carried sulfur in their parts to avoid the menopausal syndrome, that is hot feeling following perspiration, then feels chill, which is found at menopausal period. In such cases, sulfur is an important drug. Like is another one. Another important use of sulfur is for arthritic disorder. When the sailors goes with cargo loading with sulfur for few months, all the persons, all the sailors or all the persons related with that cargo who had arthritis and they are limping gait, after few months when they return, they became okay, no arthritis, no limping gait is there. So it is an important drug for arthritis. Arthritis various type, even to rheumatoid arthritis. Rheumatoid arthritis is a multifolded multi-systemic disorder, not only affect the joint but also other system also affect it. And it is one of the inveterate and incurable so-called incurable case. I attend a class of Dr. Obuni Rai Chaudhuri in NRS Medical College, who was lecturing upon the rheumatoid arthritis. He told that there is no medicine, no telpora, no jalpora, no allopathy, no homeopathy for arthritis, rheumatoid arthritis, and the physician who is good physician, he will give less painkiller because that painkiller having another effect, generally affects the GI system, etc. But in homeopathy, we have uh, prescribed according to the symptomatology of the patient, and anti-include Dr. M.L. Tyler told that antimicrobe is specific for rheumatoid arthritis, but it is not so. If the case is antimicrobe patient, then prescribe NP. If it is medorinum cases, we will prescribe medorin. It is sulfur cases, and in such way, when the sodic manifestation is superficial, then sodic indicated drug. When psychotic and miasmatic dyscrasia is flare up, we will prescribe antipsychotic drug of indicated by the symptomatology. In such way, one after another, we may able to cure or almost like cure. Which is not curable, it is difficult to cure really. According to allopathic physician, they told that if for asthma not curable, but asthma is curable in homeopathy. I have treated several patients for bronchial asthma and there is now okay. A for asthma not curable, B for blood pressure is not curable, C for cancer not curable, D for diabetes not curable, according to modern medicine. But in ultra modern medicine, that is homeopathy, uh, you know, several patients are cured diabetes, uh, diabetes, hypertension, asthma, etc. So we have not limited as they told. We can give treatment and the patient will be almost okay, may cure, and life will be prolonged, and deformity which generally occur in rheumatoid arthritis, that deformity will be avoided and he will a long life, um, apparently
Dr. Ghosh,
health. Yes,
Dr. Ghosh, please, time constant.
বলুন। হ্যাঁ।
We have time constraints. Huh?
Oh,
Already 1.5 years over.
okay. No
Okay.
problem.
Thank you.
And sulfur, all we know, we are using regularly, so symptomatology is known by us. I cited a few cases with few symptoms. Thank you for giving the opportunity to share the sulfur with you. Thank you. Okay.
Thank you very much.
Thank you, Dr. Byasdeb Ghosh.
Thank you, sir.
Actually, you have given a very good lecture. I was listening to you. You have touched the all the areas of sulfur and drawn a very good portrait of sulfur amongst the listeners. But
Yes.
Dr. D. Kollani is there. Before I tell something, I will tell something. But before that, because I know Dr. D. Kollani is a very good prescriber, so I will request Dr. D. Kollani to at least give his some major experience in nursing.
Thank you, sir. I was just waiting to listen from our sir. Anyway, as per his instruction, I have to tell something. But truly speaking, I am very scared of speaking anything regarding mathematics when Dr. Bhattacharya is there. Very limited knowledge. Still, I like to share as per his suggestion.
Dr.
First,
Bhattacharya
let
is
me tell
very
you.
old, so you should say something. Then I will tell.
Thank you, sir. Uh, Let me share my experiences that as Dr. Ghosh was telling that if you learn sulfur and Naxwinka, half the Mathematica is under control. The truth speaking, what I am experiencing that these two drugs, sulfur and Naxwinka, is practically conventional traditional patients of sulfur and modern patients of Naxwinka. So whole chapter starting from the traditional patterns of people and from the modern culture people. Most of the things can be covered by Naxwinka. Sulfur is really fact. And you also experiencing the same thing. Moreover, I want to tell you one nice incident when we were students of deep in Ahmad State complex. We are not getting satisfaction by classes of mathematics. Please don't mind for it. With regard to my teachers, I am telling there is a reason because we had two gigantic figures of brilliant scholars of mathematics. One was Dr. L.K. Nanda of third batch, and second was my friend, my classmate, Dr. Sunima. So naturally to satisfy these two persons and along with us, it was very difficult for many teachers. That's why we decided, we students of third and fourth batch, at that time we had joint classes in mathematics, means 32 students in a class, 16 classes. We decided that we learn mathematics of our own. The process will be, we decided all together that each of us, these 32 students, one will be given one drug by lottery and he will get prepared for 1 month. He will be given 1 month of time. And he have to present that drug before these 32 students and the teacher, concerned teacher. And all the students will cross him in every corner. This was our plan of learning mathematics. We convinced our teacher, Dr. L.K. Pradhan was there as in class. He was agreed. He was very happy to listen this type of classes. And we started it. Fortunately, I got the lottery on sulfur. I prepared for more than 1 month. And I was astonished hearing what Dr. Ghosh was telling. That is an ocean. Sulfur, sources, and instruction symptomatology is an ocean in our mathematics. And in near future, we are experiencing same thing. I don't want to waste much time because grand things we are waiting to listen from Dr. Bhattacharya. Only few things I want to tell you. What I learned from my teachers, Dr. P. Spa, he was a grand teacher, teacher of Dr. Manjusi, S.K. Dubey, and many teachers, our teachers. He told in class that sulfur, give sulfur one globule to the newborn and 1 globule to the mother just after delivery. This can block many soric manifestations in near future and later life because first give 1 dose as antisoric to strengthen his total vitality. And I am still using the same thing which was instructed by my teacher. Give sulfur 1 globules to newborn and to mother. And the teachings I got from my teacher that to conclude the cases, especially the cases which are supposed to get relapses or relapsing disease, there are chances of relapse. To prevent this relapse, you should complete the case by sulfur again. Dr. Byasdeb was telling the same thing. To complete many cases, sulfur will be given, but especially for relapsing type of disease, sulfur must be given. The purpose was same, to tone up the system, defensive system by giving 1 antisoric. Now, in brief, I will tell you 3 of my experiences. First, on my case, when I was first year student of DMS, I started having fever, and that fever was running from 99 to 100, daily fever throughout the day. When it was 99, sometimes 99.5, 100, this range was continuing, and this was going and going and going for 6 months. Many trials were given, starting from tuberculosis, homeopathic, different medicines by from different teachers, allopathic medicines, Ayurvedic medicines, Jodi, Booty, etc. I was still I am living in a village area. So all sort of trials were taken, but no changes. But with that fever, I was continuing dissection in Pakituku Tuberculosis Hospital in the early morning, then Calcutta Homeopathy Medical College DMS, then in the evening BSc in City College. Throughout the day I am working, continuing the classes, studying, but day by day I am getting weak and losing weight day by day. All tests were done by experts. Everything was normal, except hemoglobin low, yes, are slightly low, but not that much. Fever is not remitting. Ultimately, my case was referred to tropical school of medicine by few allopathy doctors as PEO, pyrexia of unknown origin. For experiment, what type of disease may be, whether viral, bacterial, or whatever. They agreed to take me as admitted case in tropical school of medicine. The day I was supposed to do the tropical school of medicine, one of my distant relative, one of my auntie, came to our home and convinced my father to show me to a person who is not a doctor, qualified doctor, but treating many cases, taking very minimum amount of money. Dr. S. Malik, he was RMP, registered medical practitioner. So anyway, my father immediately told my auntie, what you are telling? First, if this will be cured by a what RMP or this type of doctor, then I request my auntie, you have taken all 12, just in the last stage, take some trial. If anything happens. The doctor was called in the next day. My tropical school admission was postponed for the time being due to some reasons it was shown there. And he came with a chapel in their foot, dhoti up to the range of knee, one white shirt, one bag in shoulder, in hand, and he entered in my room where I was lying. Gradually, I was becoming bedridden. So much weakness. Just after coming in my home, in my room, he saw me and took a puff of nossi from his counter. A small dibba called nasal puffs. He just took and nodded his head. Eta আমি খাওয়াতে পারবো. Just see, one quack is telling with confidence by taking a snap of nossi that I'll be able to cure you. Everyone was astonished and we didn't care for his confidence. He saw me by putting stethoscope here and there. I understood that stethoscope is sometimes putting in the abdomen, sometimes in the back, sometimes in the loin, groin. Everywhere putting stethoscope. I concluded that he do not know how to use stethoscope. He left, asked, come to my chamber, I will give the medicine. He gave the medicine. You'll be astonished to know, after one day, I took the medicine in the morning. Next day morning, I was feeling fresh, temperature as before. Next day morning, better feeling. With his 6 days temperature become normal. I became fan of him. Tropical food admission and research work was postponed. It was reported that he has been improved. I became fan and started going to his chamber to see how he's caring, what type of homeopathy doctor he is without some degrees. And I found number of patients he's treating. Then I was trying to know what drug was given to me. And you might be knowing that traditional homeopathy doctors, they are not ready to discuss their decisions. Anything, maybe to see the quality. He is not telling the drug. After a few days of attending his chamber, I was assisting him by packing the courier and other helping since 2:30 noon to 11:30 night. Then he was somehow convinced. Then I told him, if you do not tell me the drug, I will not come to your chamber because I want to learn. Simply for learning, I have come over here. If I do not learn that you have such a disease for such a long period you have cured, then why should I come to you? Then he told, Are বুঝতে পারছো না? In Bengali, I'm telling English. ওই যে সবাই মিলে সব ওষুধ দিচ্ছে কিছু হচ্ছে না তখন সালফার বইতে লেখা আছে না? He just told me that have you not read the different type of treatment, different medicine from different sources when everything fails, then sulfur is the drug. See the miracle of sulfur. 6 months of temperature, all tests were done, neither it was tuberculosis, nor it was any other disease. Disease was cured with simply sulfur 200, only one dose, rest was placebo. This was one of the first experience of sulfur. Then second experience, a great experience I will tell you, that one patient in OPD, he came to me with a history of drug-resistant tuberculosis and intermittent vomiting, severe vomiting. Minimum half a cup, sometimes 2 cups blood come out infrequently. No reason, no time, no factor, no any positive reason. Suddenly start coughing and blood is coming. Age of the boy was about 19. He started treatment. By this time I learned use of your anyway, all the drugs of hemoptysis were tried to relieve bleeding as quick as possible with no result. Acalyph indica was given. I just want to tell you because Dr. Ghosh is there in this session. Acalyph indica manifestation and treatment and confidence I got from Dr. S. Ghosh in IPD by listening his one of his tremendous case of bleeding, lung bleeding. So anyway, that was given, tried, no result. All the possible drugs according to the symptoms immediately as far as possible was given without a result. But I will say that patient is not ready to leave me. I am telling go to tropical medicine, go to medical, go to tuberculosis department. You are not getting relief in this homeopathic medicine. You need some other treatment. And when I found X-ray, one lung, 30% is completely fibrous, and the lung, about 50% is completely fibrous. Right is less, left is tremendous. When I found the day sugar he is coming without any improvement, it stuck to my mind. What is getting here? Simply medicine minimum cost, or seeing the rush, or what is the reason? Then I asked him, why you are coming here? Once you are not getting relief by 1.5 years, not a matter of joke. He's taking sick to me. Then he's telling, sir, I will not go anywhere. You try. If I get cure, I will get cure from you. Otherwise, I am ready to die because I have gone to many hospitals. I was admitted. I was treated. They have told there is no treatment. You keep a normal average life. Medicine is not working. But I found every day whenever he comes, he is waiting for hours together. No tension, no restlessness, very calm and quiet, as if very much satisfied. Whenever coming to my chamber, he is smiling, talking about his severe bleeding. It stuck to me that what happens to make the patient happy with such a serious disease. Then I converted symptom ragged philosopher. Whatever complaint he is having, he is not caring. He is quite satisfied by living, suffering, bleeding, treatment, everything. Doctor, hospital, no demand, no craving. I thought it may be a case of sulfur. As I tried with many drugs with miserable failure, I gave sulfur 201 doses. After 15 days when he came, he is laughing. Previously, he was smiling every day with happy mood. On that day, apparently he is laughing. স্যার আমি ভালো আছি ভালো আছি মানে আমার এই 15 দিনে ব্লিডিং হয় স্যার আই এম ফিলিং ফ্রেশ ফর লাস্ট 15 days by this time I did not have any bleeding long 15 days without bleeding was never with me before. I was surprised but still he is happy with same mood rather more happy. I just continued placebo. You'll be astonished to know within few months completely bleeding stopped. I had one X-ray again. Sarasija as before, no change. Respiration rate and intensity was as before, blood no bleeding. Then I asked him to come after every 3rd month. He was coming, no bleeding, simply on placebo. What happened? Even after my retirement, he did left me by getting my contact number. He contacted me and came to my house. And he said, so long I will leave, I will come to you. Whether you give medicine or not. Because everybody told me I will not be cured, I have to die, and I have been cured by you. What I did, simply asked him to take some very common drugs which are not drug at all, like Alipos, this and that, Inaugurator, to see the lengthiest effect of sulfur. And I asked him to get one X-ray every 6 months interval. With utter surprise, within another 3 years, but I found the X-ray plate is completely clear. As Dr. Ghosh was saying, exactly the same experience is with me, that by giving the right drug in the right patient, fibrosis can be cured, which is unbelievable by conventional system of medicine. Completely normal lung, normal breathing, no bleeding, not even a drop of bleeding. Patient gained weight, having a normal life. Now he has children, married, normal life, with all sort of strain of was his continuing. So this is the efficacy of sulfur 200 only one dose by seeing the ragged philosopher means very happy whatever situation he has, whatever what situation he has. Another case of IPD. I was called by one of our union leader, student union leader in I. Sir, you have to see one case. I have brought him from my village to show you. I have made him admitted. So I went to see him. I found that one boy of 9 years, he was caught by his mother, standing on the cot, means bed, with completely lax legs. Means with heart strain, mother is holding the child to show me his condition, completely lax hand, not able to move a least, completely lax legs, not even to move a least, motor neuron disease since birth. He is growing, but strength is zero of his limbs. I told him that why you have brought to me, not why not to Bangladesh Institute of Neurology. Senators are everywhere. You have taken the patient, but they told it is not curable disease. Congenital myopathic disease is not curable. Then I brought to him. He is my very close in my village. His family members look after whole our family affairs. So please do something. Some changes can be done. Mother is very embarrassing by this elderly child. Feeding, walking, standing, sleeping, everything by help of his mother. He's not able to move sides. I came to see him. I learned one thing from my teacher, Pishidar, and later on I heard from Dr. Vidal Kaus that unless you are sure of a chronic disease, especially diffuse disease, unless you are certain and sure, do not suddenly prescribe a drug. Wait and observe, wait and observe. It may show up in after 10, 15, 20 days, one symptom will come up, which will give you the guideline of this right drug. So observe, observe, and observe. Once I found the case is not curable, and I have also studied very difficult cases, I simply started the same thing that observing temperature of the beach, temperature of the body, how he is moving, how he is blinking, hair, everything, every day going, seeing, giving pleasure and coming back. Every day they did. But what I observed that whenever I enter in the IPD room, the baby starts smiling. One day I asked the mother, does your baby smile whenever anybody comes? Mother is saying, no, sir. When a person who loves him or he prefers him, whenever comes, he is very happy, which is very common to everybody, all the children. Then I what did that I asked my student, you go and ask how he is to observe whether he is convinced on my appearances, my talking or some other things. So whenever he went, I was thinking from distance, and he's talking about Keman acho, then the child started smiling. Mother is replying, but child is smiling. This I observed for consecutive 3 to 4 days, that in my absence and presence, whenever anybody is coming and attending the baby is starting smiling. This experience, ragged philosopher, to a child, baby, means he is not dissatisfied. He has no tension, no attachment to developed world, not even this thinking while others are walking, smiling, holding things, jumping. He doesn't care. He is happy with his sufferings. Same medicine sulfur was given to him after a long observation. And all records are with me. You'll be astonished to know within 10-15 days, gradually, mother telling that his hands is sometimes move automatically during sleep. Then legs are moving automatically. Gradually, limbs started moving. Then I left the patient. I asked him to take you home, come out for 1 month by placebo. They took the baby at your home. After 1 month, when baby came, you'll be astonished. Baby was mother's lap, but nodding hands, nodding his legs. Observation, but with the same smile as I saw before. Placebo asked the patient to come for 3 months and advised that dig a bore in your home in the ground by which the baby can be put on the made dig by which if possible he can stand, he can sit on the ground. They did it. He put the baby on a digged what should I say যেটাকে আমরা বাংলাতে গর্ত বলি and gradually report came by my student that sir gradually the baby is getting strength in the legs and he is sitting on the ground putting the legs on the dig and gradually getting strength. He is able to keep his head straight, which was not before, automatically nodding heads. Within 6 months, one day, with surprise, I found that the baby is walking reluctantly, not able to maintain his gait, but reluctantly by holding his mother and by this chimpanzee movement, he is coming to me, to show me in the OPD. Same medicine was repeated after a long period, 200 sulfur again, when I found that improvement has become restricted, no further improvement. And ultimately, patient become completely normal, he is maintaining normal life. So this baby is not only got a new life, but whole family got a new life to survive than that of maintaining this type of child throughout this life. So this sulfur is such a drug. Whenever we find that patient is happy with the situation, whatever worse it is, whatever ugly it is, whatever bad it is, he has no complaint. Rather very happy, feels proud. As Dr. Ghosh was telling, feels like a monarch. Please think of sulfur and you will get the miracles. There are many experiences to our senior Dada and now my director, respected sir, Dr. Bhattacharya. We are willingly waiting to listen his experiences, please.
Thank you, Dr. Kalyani.
Thank you, sir.
Actually, after a long time, I am attending a academic seminar, and it is a opportunity for me to recapitulate many things. Dr. Byasdeb Ghosh very slowly, very nicely drawn the picture of the sulfur, and what was deficit there has been made up by Dr. D. Kalyani. It's a very interesting uh, lecture from Dr. D. Kalyani. We have learned many things from him. Now I want to tell something about sulfur. Number one, what I want to tell. There are two medicines in our Materia Medica which are being maximum misused and beneficially used. And these two medicines are number one, Nux vomica, and number two, sulfur. So maximum misused medicine is sulfur, and maximum used beneficial medicine is also sulfur. So for prescribing sulfur, we must be very cautious. I will tell one of the experience of my grandfather, what I saw from his writing. He has written, whenever you find the symptoms of a particular medicine, prescribe it. Whether it is a cancer, whether it is a deep pathological change, whether it is there is anything which is usually known as contradiction, to prescribe a deep acting antisoric medicine, but prescribe in moderate potency like 30, not too high. Because sulfur, like medicine, without such medicine, certain cases cannot be opened, cannot be cured. But there he has written a very strong point which is to be observed. He has written that this prescribing what I am writing, this is not prescribing on this constitutional symptoms. This is on the present symptoms of the patient. If it indicates sulfur or a medicine, when usually it is not, it is written that it is contradicted, still you prescribe. But don't prescribe on constitutions, because constitutions does not change. It will remain constitution. Some constitutional feature, the child and the old age, up to old age, they will bear the same symptoms. And on those symptoms, if you go on prescribing, sometimes it will do bad. So where you can prescribe in such deep acting cases, deep pathological cases, when the symptomatology, present symptomatology, is indicating the deep antisoric medicine. This was written by my grandfather in his book. Now, I shall tell, first of all, some cases of my seniors, my teachers, my gurus. Number one, I am going to tell you one case. After that, I will come to discuss about some points of sulfur. Dr. Jain Kanjilal, he used to come to National Institute of Homeopathy, and you know I was the student of the first batch of NIH. And he used to come to our outdoor to teach the students. We used to take some cases when he comes, someone who has taken the case, he will read it, he will listen it, then it will be discussed, and he will ask whatever medicine you want to prescribe, and then he will prescribe. One case which was taken, some of my friend, Dr. Kandilal came. He was sitting, listening the case, and my colleague doctor student, he was reading the case taking paper. We saw that Dr. Kandilal observed the patient for a while, then he became in such a position, and we were astonished to see he was sleeping. And throughout the period, 1 hour, the student has taken so much case taking. We are reading, and he was sleeping. Just after awaking, just routine, he asked, "What medicine you want to give?" Then we told, "Sir, what we will give? This case has been seen by all our seniors. Their prescriptions are there, so we did not think, because whatever we will think, it is there." He told, "Give him a dose of sulfur 30. So it was written. The patient went to take medicine. Then we asked, "Sir, why sulfur? Why sulfur 30? No, there is many symptoms of sulfur." "No, sir, there is no specific symptoms of sulfur is there, what we have read. There is not like that." No. You ask the patient to come. The patient again come. He asked some questions, whether you have got these symptoms, what is your symptom, this, that. But we found nothing of sulfur. Then he told, "Let the patient go." The patient went to take medicine. He told, "Yes, there is no subjective symptoms, what he has narrated and what you have taken, it is not of sulfur. There is nothing to prescribe sulfur. But didn't you observe the patient? The peculiar hairstyle, the peculiar entry style, I have observed that, and I have cornered all your case taking, and I have prescribed a dose of sulfur. You see, after 1 month when the patient comes, after 1 month the patient came, and we found that the patient is almost 50% or 60% he was cured with a single dose of sulfur 30. From that date, I am lucky. I have seen some such teachers who shown us some patients, their hairstyle. I have seen another, this is not of sulfur, but I am telling you. Dr. B.K. Bose, he was taking our class, and he used to tell everything other than materia medica or organon in the class. So one day, suddenly he saw one student, girl student, and went to her, hold her head like this, and started shaking like this. "This is sepia, this is sepia, this is sepia, this is sepia." And the students started something, what, this, that, and suddenly he was a man like that. He was a great teacher, great prescriber. We have never seen such a prescriber other than him. Such great prescriber. So he started talking something else. But I observed that head, the hairstyle of that lady. I am telling you, this is a peculiar male type of this type of hairstyle with central Sithi, and this hairstyle is like this, and he was shaking like that. Whenever I see such patient, I try to find out sepia, and I have seen most of the cases improve it. So that day I learned sulfur from Dr. Kanjilal, the look of a sulfur patient, not standing. That we have seen many times from many teachers. but that hairstyle of the patient. So that is one case of Dr. Kanjilal, I told you. Now I will tell you one case of Dr. B.N. Chakraborty. He was a very, very good prescriber. I have seen. He came to NIH. We were just sitting in Dr. Ghosh's chamber in the hospital. He came there and started this, that, telling, and he narrated one case that a child was brought to him and his stool, loose stool, chronic loose stool, was not controlled by any allopathic medicine, any homeopathic medicine, and he just casually wanted to see, this is the observation, many sulfur is, you can prescribe sulfur more on objective symptoms, more, that is the congestion of the single parts. He saw the child very clearly, closely, something he saw on the nasal side of the child. Then he immediately told that lady, his mother, to remove the napkin, and he saw the rectum and prescribed a dose of sulfur with getting congestion in the rectum. But how he came to that? Seeing the nose, there is a congestion. Congestion in a single part. There is no other medicine, single one or two or orifice. This congestion is a earmarked symptoms of sulfur, and he saw that in the nose. In our nose, he found that there is a congestion in the nose, and then he went to the rectum and he found there is a congestion in the rectum, and then he prescribed sulfur 30, and with a single dose of sulfur 30, that child became all right. So these are the two cases from our teachers, stalwarts. I told you. Now I will tell another case, not a particular case, but what I have seen. My father was also a good homeopathic practitioner. I have seen. Peptic ulcer, many cases of peptic ulcer, I have seen him cured with single dose of medicine. Mostly, there were many other medicine used to come as per symptoms. Not all cases, but many cases I have seen to prescribe either a dose of Bryonia 30 or a dose of sulfur 30. And that is final. After a single dose, he used to wait for a long time, and gradually we have seen the patient is being cured. Bryonia where? In peptic ulcer, when there is sensation of fullness in the epigastrium, as if something is pressing from inward to outside, and in sulfur, there is burning with emptiness in the epigastrium. With these symptoms, he used to identify mostly the cases were like this, and many cases were cured by a dose of single dose. No repetition. A single dose of and a dose of Byania, either this or that. So these are some cases I have. I was thinking that I should tell you, because these are my observations from my seniors, my father, my grandfather, and my teachers. Now, I want to tell you that sulfur has got three types of mentality, temperament. And if you can observe those temperament, you can clearly come to conclusion about sulfur. Observation. What? In one way, sulfur is sometimes highly intelligent, sometimes highly foolish. These are the two things. Sometimes alternate, and two bipolar. Sulfur, there is a prideness, and that prideness is foolish prideness. Total lack of moral power. Total lack of moral power. Sulfur, you will understand that sulfur is maximum greedy. Greedy like lycopodium. But there is a difference in greedy of lycopodium and greedy of sulfur. Lycopodium has greedy not only for taking food or this or that, but for money also. That greediness is in the mind, in monetary level also. But sulfur has got greediness in many aspects. Lack of total moral strength, but not for money. Money, lycopodium. Sulfur has got no moral restriction, has got all. Dr. Byasdeb Ghosh has told clearly that all sorts of alcoholic drinks, I am telling you, not only alcoholic drinks, in all types of addictions, not only alcohol, even smoking, even other types of addictions, and all types of alcohol. He cannot resist. And he knows there are two medicines that they know this is doing harm to him, but they cannot resist themselves to do it. There are two medicines. One is tuberculosis. That I learned first from Dr. S.B. Dotto. In the class, he has narrated this very nicely. And the second is sulfur. Cannot resist. He knows that it will do harm, but he will not. He will think, this is the last I am smoking, this is the last I am drinking, this is the last I am doing. But he will not be able to restrain himself from doing it. That is the personality of the sulfur. And due to that lack of moral strength, for king of the antipsychotic is Thuja, king of the antisyphilitic is Maxol, but patient will not become Thuja, will not become Maxol unless he was initially a sulfur patient, because that greed is not present in Maxol. That greed is not present in Thuja. It is present in sulfur, which takes him to there and get the disease. And so much that mental his greed that he cannot resist him for addiction, for food. Dr. Byasdeb was telling that there is aversion for meat. I am telling you, yes, it is written, but sulfur has alternate. Sometimes he has got very strong desire for meat. Sometimes he has got strong desire, aversion for meat. Sometimes he has got strong desire for sweets. Sometimes he has got strong desire, aversion for sweet. Sometimes he has strong desire for salt. Sometimes he has strong desire, aversion for salt. So this strong desire and strong aversion both are present in sulfur. And sulfur is another important medicine I am telling you. As for addiction, I have told you. Another, this is a very burning problem. Many doctors are facing this problem. I am telling you, sulfur has a most important symptoms, sexual symptoms, that is very quick and easily ejection. No medicine is compared to sulfur in this aspect. No medicine to compare to sulfur in case of addiction of alcohol. Sulfur has got these two symptoms, most important symptoms. And another thing, what I have already told you, heat, burning, congestion. Sulfur is a medicine for the circulatory system disorder. As a result, sulfur, I have observed in my practice, is very frequently indicated in high blood pressure. Either high blood pressure, even then there is also alternate. Sulfur is alternate in constipation and diarrhea. Sulfur is the alternation in desire and aversion. And sulfur sometimes very hot and sometimes very cold. Sometimes sulfur has aversion to bath, and sulfur sometimes has got strong desire for bath also. Sometimes you may become confused when a patient comes to you with very good suited, booted, and very good dress. You may think that he cannot be a bishop. But you will see there is some irregularity in his dress code. It is not regular. Arsenic album, it is regular. Everything is matched one after another. There is no irregularity in that. Sulfur, with everything in good style, one amongst it, it is irregular. So this is the constitution of sulfur. Now another strong indication for sulfur is offensiveness of urine. Offensiveness of urine, you know, acid nitric, you know, benzoic acid, you know, sepia. Similarly, sulfur has got, we have to compare if there is offensiveness, what is acid nitric, what is sepia, what is benzoic acid, and what is sulfur. So sulfur has got also offensiveness in urine, and that offensiveness is not strong like benzoic acid or acid nitric. It may be little bit compared with sepia. That is offensive but not so strong. Ammoniacal. It is not ammoniacal. It is offensive in case of sulfur. Another thing Dr. Byasdeb told, but I want to again tell it. There's aversion to bath, where it is very similar. We should compare it with antim crude. Antim crude, sometimes you will be confused whether it is sulfur or it is antim crude. Antim crude wants bathing, but afraid of cold bathing. Even sometimes he get unconscious, or sometimes he gets tremendous headache after a cold bath. So, but sulfur hesitating. Patient will say, yes, I take bath. Do you take bath readily? No, sir. Sometimes I hesitate, particularly in winter. So you can understand that he is not opening, but he has got some aversion to bath. Another important, my observation I want to tell you, definitely without symptomatology we should not prescribe, but I have seen many cases that sulfur in a single dose high potency, if the symptoms is there, a very good medicine for expulsion of renal stone. A single dose of high dose of sulfur, if there is no deep pathology and you see the constitutional feature in the patient, a single dose of 10 m sulfur, and I have seen many cases, it follows a severe pain one day and gradually it is relieved either with your medicine, without medicine, or some painkillers have been given by some doctors, it was relieved. But after that, on ultrasound scan, we have observed the stone is not there. Many cases I have seen sulfur, if indicated, if the constitutional features are there, if there is history of suppression of skin disease, and definitely it is a medicine in such cases. Dr. Byasdeb has told, that is also my observation, that in post-menopausal syndrome, there are so many medicines written in our book, but lachesis or sulfur, these two medicines I have seen that it is coming at the top, and it is usually being indicated in postmenopausal syndrome. Another thing, for skin disease, I have seen in Organon, then I started this practice. It is written in our Organon, 5th edition, that when there is open shoric case, not suppressed case, open, sulfur X potency, it is written there, that is 30 potency. Master Hanneman has clearly written there that sulfur in X potency, that is 30 potency, in a suitable interval of 10 to 15 days, no routine. It is not every time it is 15 days, every time it is 10 days. But in a suitable gap, observing the patient, in a suitable gap of 10 or 15 days, a single potency of 30 sulfur in such cases. Sometimes he has told clearly there that sometimes after sulfur, if there is severe aggravation, and Dr. Byasdeb and Dr. Kalyani, both are the students of Dr. S.P. De, you have learned many times from him that when after sulfur or some certain homeopathic medicine, there is a severe aggravation of the skin disease which cannot be controlled, a single dose of Marksol, which removes the syphilitic dyscrasia, hidden syphilitic dyscrasia, will remove that aggravation, and gradually your sulfur will act and the patient will be cured. Hahnemann has told not only Marksol, and I have seen also that even pulsatilla, even Nox vomica sometimes are given to minimize the aggravation after sulfur. Another thing regarding potency, I am telling you that when you want that a suppression should come out, there the potency should be very high. Whenever you don't want the suppression to come out, you should either go to 50 millisimal scale as Dr. Byasdeb was saying, or a lower potency, moderate potency like 30 should be used. Now, burning is a very, very important symptoms. Sulfur is based on some observations. You will see that the student in the class sitting, he has removed the shoe and kept the foot bare on the floor. Patient has come to you, you are taking the case, he is answering to you, and suddenly you observe downwards and see that the patient has removed the shoe and kept the feet on the floor. Why? Due to heat, due to burning. He wants some cold to relieve it. That is an indication of sulfur. But with this heat, sulfur is definitely hot patient. Of course, sulfur has chilliness also in certain conditions, but mostly it is hot. But hot patient with very minimum perspiration is an indication of sulfur. A haughty patient, usually haughty patients, proud patients, they will sit like this, a king-like sitting. But a haughty patient, a proudy patient, sitting stoop-shouldered is a sulfur patient. A patient comes to your clinic, is standing for sometimes, he will not stand erect. He will stand with stoop-shouldered. Sometimes we are confused whether it is phosphorus or it is sulfur, because both have got the same type of features. Sulfur is more flat, it is less flat. But how can you differentiate with more or less? That is the question. So you will have to find out some other symptoms of sulfur or other symptoms of phosphorus to compare it, to differentiate it. Sulfur is a very, very good medicine for acute conditions. Acute conditions, conjunctivitis, you can safely prescribe sulfur. Acute conjunctivitis, when you see that even on the third day, the one eye is congested, the other eye is clear. Congestion in the single part, which usually if it is a normal case, otherwise case, it should first, it can start in one eye. You should not give that sulfur. But Gradually it will come to the other eye also. The congestion will spread. Many times you will see a patient has come with bloody spot on the sclera, hemorrhage, bloody spot. You see the blood pressure, it's too high. And when you see that there is single part bleeding on the sclera with high blood pressure, please don't immediately send the patient to other medicines. Try with a single dose of sulfur 30. Wait for some time, give some time. Gradually, not only that bloody spot will be removed, you will save the patient from taking blood pressure medicines throughout the life. You will find pancreatic disorders, blood sugars, more goes to lycopodium. High blood pressure, low blood pressure, congestion. There may be congestion in low blood pressure also, congestion in high blood pressure also goes to sulfur. Just this is the differentiation in chronic stages. And in acute case also, you will find there are observation will lead you to prescribe sulfur in high fever, in many other acute conditions, even burning in micturition, burning during micturition, without any other symptoms. You don't find anything. Even you culture, it is negative. But there is severe burning during micturition. With other symptoms, few symptoms gather, and you can prescribe a single dose of sulfur in high potency, 1 ml or more. The burning will be removed forever. So, sulfur in acute conditions, diarrhea, acute diarrhea, fever, acute fever, cough, anything, any place. With the other indications, we have seen a single dose of sulfur is curing the patient. But one thing I am telling you, don't be very optimistic on one medicine, then you will do harm to the patient. Try to take the case properly, follow the proper guidelines of homeopathy, and when the proper guidelines will tell you to prescribe sulfur, then only you prescribe sulfur. And for prescription of sulfur, I am telling you, very rare cases I prescribe in 50 millisievert scale. This is my view. What Dr. Byasdeb has told, it is his observation. Very good. But my observation is also like this, that I usually prescribing sulfur in 50 millisievert scale. Sometimes we can do it where, suppose a patient has come to us who is already for 10 years, last 10 years taking some medicines for his blood pressure or some medicines for his cardiac reason, blockage or this, that. Can you stop the medicine immediately? Should not. So what to do? That is a place where you should give, if sulfur is indicated, give in 50 millisievert scale, and your because every time your medicine is going to be disturbed by the allopathic medicines or other medicines, which you cannot stop, which you should not stop immediately when the patient comes. If the patient is better, the blood pressure coming down, we have seen many cases. Gradually, blood sugar medicine, blood pressure medicine has been stopped. That is separate issue. But without having any effect, initially you cannot stop it. So that is the place where we should try with 50 millisievert scale. I also try in sulfur. But when I prescribe definitely for certain symptoms which is present in the patient, there I have seen, even I have prescribed a single dose of sulfur 6 or single dose of sulfur 12 and observe that 1, 2, 3 months, the patient is gradually improving. Be it skin disease, even skin disease also. A single dose, not repeat, not repeat. A single dose of sulfur 12, a single dose of lycopodium 12. And these observations I have learned from Dr. Jane Kanjilal. I have seen him prescribing like this in many cases. I think we are already too much late. Everybody is hungry, so we should stop here any day. If we get time, we will discuss more. But anybody, if you have got any question, I don't know how to answer and questions. But if you want to tell anything, I can reply to it. But let us conclude. Let me conclude my lecture here, and I thank to particularly, I don't know whether he is on the line or not, Dr. Chandrasekhar Pore, who asked me, sir, you will have to come and tell something. And okay, I agreed. I am thankful to Dr. Bidyut, Dr. Narayan, Kalyani, everybody who are maintaining this program since long with their hard labor. And ডক্টর মিস্টার অর্ক, ও ডক্টর কিনা আমি জানি না, বিদ্যুতের ছেলে,
Going
he
to be
is
doctor.
also, I have seen he is also doing much contribution to this program. Thank you all.
That
Yeah.
will be given 1 minute time, one more for one case. And
Yes,
may I be allowed to speak more, 1-2 minutes? Another one
yes,
case of
yes,
sulfur.
yes.
So, thus I'm sorry to disturb all of you because it is too late. And let's just CME of within this 90 CME. We are getting interested, I think, everybody. My first experience of sulfur is very interesting. One day I found my mother is complaining to me at that time as the early student of DNA that some area of my thigh has become reddish. So what I found that area has become fiery red, like herb area. About 6 inches by 5 inches approximately this area right thumb. So I was very much shocked. And I started by this time sulfur localized congestion. So immediately I gave my mother sulfur 30. That is my first experience with sulfur.
Very good.
Within 2 days I found little bit improvement. Then I gave 200. Then I talked to my teacher, Dr. M. Dotto. Sir, my mother had this type of condition in the thigh. I gave 30. Improvement started. I gave him 200. Improvement continued. He did not allow me to complete. He came with his slap. That who told you to give you 200? Who has taught you? We are giving this potential without asking us. Then he became very quiet. He's a very gentle person, very nice man. He told, do not even use placebo. See the beauty of sulfur. Not only your mother's redness will go off, you go on observing for months and years. Other complaints of your mother, how she is feeling, and you must tell me intermittently how she is regarding other complaints which has not been treated before. I came back to my home. I stopped giving any medicine. My mother started improving, and become completely normal. And astonishingly, I found that the more days and months are advancing, other big companies of the mothers are gradually relieving, improving automatically without any medicine, even without placebo. I reported to Dr. Iman Dr. said these things are happening, what you told. My mother's previous complaints are gradually getting relief, which are suffering, she was suffering for a long period. She had told me, see the beauty, learn and get confidence. The efficacy of sulfur. So this localized congestion, though it is not congestion in modern term, it is called hyperemia without dolor and calor. Means it is hyperemia, means more circulation in a particular area without pain and heat. Congestion is venous deposition, but this is arterial deposition, arterial capillary deposition, hyperemia. So whenever you find anywhere hyperemia without pain or heat, that is said to be congestion in our literature. It is sulfur. And to that thing, like I just experienced by my first patient of sulfur, that not only the complaint, but also the complaints yet to be treated are subsided or suffering from a long start getting cured automatically by minimum dose of sulfur. That beauty I have experienced in early life. So many thanks. We are very lucky, sir. What should I say? More we are, as I was saying that by this 90th CME, we are
One
very
thing.
retired.
Just a minute.
So please,
One thing I
please, sir,
forgot.
please, sir.
I want to tell one thing.
Please,
That
please,
is
please, sir.
in our repertory there is one medicine, damn liar, Bretram
Right.
album in our repertory. But I am telling you, shameless liar, nilojjor, shameless liar is sulfur.
Very nice. Very nice.
Okay, thank you.
Today's seminar is not only brilliant seminar, but also great stimulation. As I was saying that all of us who are striving, like Dr. Chandrasekhar, Dr. Bidyut, uh, Mukherjee, all of us gradually becoming tired by this 90th CME. But Sir has inspired a lot. Presented by Dr. S.K. Bhattacharya and Dr. Sarasija Ghosh has inspired us seriously. We are getting strength, we'll strive again to continue this CME. And our earnest request to Sir to please come as and when we feel tired and relax, please come to us and inspire us. By which you can continue. With due respect to
Thank
Sir
you.
Dr. Ghosh, Bidyut, please.
Thank you so much, sir. Our pranam to SKB sir, Byasdeb da, and our respected Kalyani sir. Though I am out of station, but the commitment of continuing on with this continued medical education online program, it's still going on with all your blessings of our seniors, the well wishes of our juniors, and our colleagues. Uh, I request our respected SKB sir to please spare some time again. And we are really proud to have tonight SKB sir along with Vyasdebda and first time in CME of NIH, Dr. Sarasija Ghosh sir. Though sir is not keeping well since the last few weeks and few months, but still, once we had requested Dr. Ghosh sir or Chandru had requested our beloved, respected SKB sir, nobody said no. All were with their open heart kept blessing us. Thank you again, sir. And tonight we didn't find any questions in the online chat. So, with permission of all the seniors, I am returning back to the backstage editor. Over to Orko.
Thank you. Many thanks. I go down the longest CME, lengthiest CME, about 3 hours. Thank you all.
Thank you all. Thanks for watching. I hope you have enjoyed today's CME. And if you have enjoyed, please do make sure to give it a like, share with your friends and colleagues, and subscribe to our channel for more contents like this. And with the IT related issues, let me just clarify on behalf of my IT team. that we are working on it. There are many IT related stuffs we are facing. There are some technical stuffs which we are facing currently, and we are trying to make it up as soon as possible. Please spare us some time, and we request just few time. Just give us some time, and we will be back on track. So, with this, let's just say good night to all of you and see you in our next CME. Until then, it's me, Orko Mukherjee, leaving. Good night.